Emile is a senior scientist at the Institute for Work and Health that's in Toronto. He is also an associate professor at McMaster University Department of Economics, assistant professor at the U of T Dalla Lana School of Public Health. So he's got a tremendous range of involvements and expertise. He's co-director of an organization I'm very proud to be associated with, the Center for Research on Work Disability Policy. That's an initiative funded by the SSHRC, a partnership grant. We're well into that project. Emile is a labor and health economist. I won't give you all his background, it's in the materials. And what he has brought to our field of work is analysis and sort of an economic economist perspective, but applying it to population health. And well beyond the disability issue, I work a lot on the issue of banning asbestos, and Emile has brought his talents there as well. So Emile, I'll hand it over to you to sketch out that mountain to climb.
Yeah, being the economist, I was asked to give the numbers picture, and so I'll do that. I'm gathering together all evidence from various places, not just my own work. It's not a pretty picture, though. I'll just warn you of that. So, okay, so I put the number stuff under a banner I call the burden of work disability in Canada. I'm not sure if you've heard of that terminology, but I'll give you a bunch of numbers. I'll give you a sense of how much it costs, not just in dollars and cents, but in resources and people time, and how much is being lost by Canada by not being an inclusive labor market and across the board kind of thing. We're all going to talk a lot about the work disability policy system and some challenges in that kind of context as well. We've heard a lot about opportunities that employers are doing, really innovative employers, but I'll just touch on lightly on some of the challenges and barriers that we hear from employers. And then I'm going to just summarize with some key opportunities moving forward, and we've seen some of that already, so I'm probably going to be touching on things people already spoke about. So here's some numbers. So in 2012, over 2.1 million people in Canada, that's 11% of those who are 25 to 64, reported having a disability. So quite a large proportion of Canadians who report as being disabled. Yet the employment rates of those people are 49%. So only 49% of those 2.1 million people are employed, compared to people who are not disabled, 79% of people are employed, right? So that's an absolute difference of 30%, so quite a bit. In terms of labor force participation, that includes people who are also unemployed, who are participating in the labor force. 55% of people with disabilities are participating in the labor market, whereas 84% of people who are not disabled are. So again, a difference of 29%, quite a huge difference there. The unemployment rates are also almost twice as much for people with disabilities. So these are people who are actively looking for work, 11% compared to 6% for people who are not disabled. So persons with disabilities, just some general characteristics, are usually older, probably because a lot of disabilities are later onset. They're less educated, it has less opportunities in the educational system as well. But even after adjusting for these two characteristics, the differences in employment rates still remain. So here's a chart from, this is someone from Statistics Canada, Turco, from 2014. What we're seeing here, and I'll walk you through this really quickly, we're seeing here in people with less than high school education. That's the people who are less than high school education, very severe disabilities, moderate disabilities, mild disabilities, and no disabilities. And this is the employment rate. So we can see the difference between no disability and people with disabilities, quite statistically significant differences in employment rates if you have less than high school education. If we move to high school education, again, we see very dramatic differences. So even with high school attainment, there's a dramatic difference if you're disabled versus not disabled in terms of employment rates. A little bit less dramatic, but still statistically significant if your disability is severe or moderately severe, but not if you have just a mild disability. And then with university degree, you do much better. Obviously, the opportunities are there with your human capital, and only the people with very severe disabilities are much less employed than able-bodied people. So quite a remarkable picture, actually. Higher educational attainment may help, but there's still discrimination happening in the labor market. In terms of occupations and income, people with disabilities are less likely to be in management and professional occupations. We've heard that from somebody else this morning as well. They're more likely to be in personal and customer information services. They're less likely to be employed full year, full time. And they have also, even if they are employed full year, full time, their incomes are lower. And we have some statistics here. For women, For no disabilities, the average is $49,000, just under $50,000. If you have a severe disability, it's only $42,000. For men, even more of a dramatic difference. For able-bodied men, $67,600, but only $49,200 if you have a severe disability. So huge wage discrimination happening there. Here's some data that I've put together from people with injured workers who have a permanent impairment from their work injury. And what we're doing here is looking at people from the point in time that they have experienced their injury and following them over time, over many years. So this is the injury year for them. We match them up with their peers who are able-bodied and who did not have a work injury to see how well do these people fare in the labor market following their work injury compared to their peers. And you would think, that we often think of workers' compensation as being the Cadillac kind of program that offers lots of supports, great wage replacement rates, return to work efforts, and paying for pharmaceuticals and prosthetics and a bunch of other things. You'd think these people would do quite well getting back into the labor market, but we don't see a pretty picture here either. So we see people who have impairments of 50% here, very, very low levels of recovery of their earnings, less than 20%. If we look at the 20 to 50% impairment levels, they recover only 40%. It goes a bit up when we go to 5 to 10%, goes up to about 80%, but still they don't fully recover their wages, even with all the supports provided by the workers' compensation system. So that just gives you some more of the details of where they're at. Here's another picture of that same cohort of people, but just separated out, just looking at one strata of that group, the 10 to 20% impairment levels. That's the biggest cohort group of injured workers who experience a permanent impairment. They're in that 10 to 20% impairment level range. And we see quite a disparity of earnings recoveries. Here we see 41% recovery. So 41% of that group have a recovery of less than 25%. So almost half of them recover only less than 25%. 38% recover over 75%. So another about 40% do quite well. And then a big group that's in the middle, about 22% recover, a small group in the middle recovering between 25 to 75%. So really polarized. You do really well or you do really poorly. Very few people in between covering those mid-range amounts. So really a very tail-oriented recovery rates. 75% or less than 25%, and in between very few people. Here's another graph. This looks kind of scary at first, but it's not so scary. This is following individuals over their time after work injury, the people with permanent impairments, to see what their earnings trajectory is over time within person, and to cluster together the common paths that people have in terms of earnings recovery. And I'll just highlight a few of them. This group here, it's the lowest trajectory. They recover 20% of their peer earnings and go downward from there. And how much farther can you go from 20%? That makes up 25% of that population. The next group, number 2 group, they start off reasonably high at 100%, but very quickly spiral downward. That's another 12%. The number 3 group, 20%, they start off at 20% and slowly make their way up. We're talking about more than half that cohort already. And then there's a third of the people who do okay. This third do okay. They're at this mid-range trajectory of 80% sort of thing. So again, just re-emphasizing how difficult it is for these people to get back into the labor market. And this is obviously late onset, people who have a career in the labor market already and have sustained a work injury and a permanent impairment as a result of it. So they have very substantial skill sets to offer and yet still have trouble getting back into the labor market with all the supports provided by workers' compensation. This is a picture of the complicated disability policy system of supports that we have in Canada. I won't go through them all. You might have heard some of them. There's 8 of them listed there. There might be others that we're missing. Can you imagine trying to navigate that maze of different programs, figuring out where you can get the supports that you need when you're suffering, in pain and suffering from a health condition, whether temporary, longer term, or permanent? And that's a challenge for people. So navigating that maze is a challenge. There's different types of programs, have different eligibility requirements, different definitions of disability, and different levels of support. So the system is really siloed. It's not aligned. Multiple programs at the provincial and federal level. They're all administered independently. Different eligibility requirements, as I've mentioned, and different definitions of disability. So a real challenge to navigate that maze. There's lack of assistance for navigating that maze. You're on your own to go to each of those programs to figure out whether it's the right program to provide the supports that you need. So timeliness is obviously an issue as a result. Navigating the maze consumes a lot of people's time. Some people even fall through the cracks and end up with no supports. So what's also missing is active labor market supports in some of these programs. The workers' compensation programs tend to provide a lot of active labor market supports, but the other programs really focus on providing the support through wage replacement and other types of subsidies. And as I mentioned, oftentimes workers fall through the cracks. And the last resort one is welfare, social assistance. So and actually one of our colleagues, John Stapleton, talks about the welfarization of work disability because lots of people end up turning to that program of last resort. Here's some data from John Stapleton's work, just to show you the magnitudes of growth in the expenditures of these programs over a 5-year period. It's grown overall by 23%, so incredible growth over a 5-year period. So more and more people turning to these programs for support because they are not being able to get engaged in the labor market. Here is also some more information that compares all of Canada with Ontario. The point that John Stapleton makes in this work is that in some provinces, the growth in social assistance for persons with disability is growing at an astronomical rate compared to other programs. Ontario here, a 17% growth in expenditures in social assistance for people with disabilities compared to 7% overall in Canada. So that's what he describes as the welfarization of work disability policy. Some of the gaps in the program coverage, there's really a lack of mid-range sickness absence programs. And there's an EI sickness, which provides support for 16 weeks, and then the others are very extreme, CPPD or social assistance for persons with disabilities. You have to be wholly and substantially disabled. Workers' compensation provides partial supports, but other programs are really for wholly or substantially disabled. And then something that other people have mentioned as well is the lack of pharmaceutical benefits for people with disabilities. If some people, when we've heard these stories from people, they're afraid to leave the social assistance program because they have to give up their benefits from that program. And employers just can't afford to provide that kind of generous programs. So what do? They're either stuck on siloed program, social assistance that's means tested and below the poverty line, or they risk losing those supports. Some of the challenges we've heard from employers in our conversations with trying to find out where those barriers are, a lot of it is just culture and stigma. They're just afraid they don't know what to do. There are sometimes concerns about productivity issues, concerns about the costs of accommodation. In fact, that's oftentimes what we're asked about is what is the cost of accommodation, and also what the business case, what's in it for us if we do invest those costs. Fear of liability issues, and generally a lack of skills and knowledge about best practices, about how to go about doing that in a good way. And we had some great examples from the panel this morning to provide some motivation in that it can be done in a good way and be inclusive. Some key opportunities going forward then. This is my last slide. We talked about, actually in the tables, one of the tables last night was about standards to support development of best practices. We've heard a few people speak about mental health in the workplace standard. We're in the process of developing a work disability prevention management system standard with the CSA group who had one of the tables yesterday. Other best practice guidance, well, the employer experiences that were presented this morning, really good guidance for us to go forward with. The roundtable discussions from yesterday, all of the roundtables talked about, best practices going forward. And then panel discussions later today and tomorrow. Hopefully we'll bring some more best practices forward as well. Some other initiatives at the federal and provincial level, the forthcoming federal legislation was mentioned. Employer peer support initiatives such as the Canadian Business Sensibilities, which was funded by ESDC, was started up a couple of years ago, providing peer support for the employer groups. Several promising provincial level developments have been mentioned. The Partnership Council was mentioned already, and various service providers that are facilitating employer capacity and uptake as well. So lots of good things happening out there too. So hopefully my not so pretty picture has some positive final notes to take us forward. Thank you.